I have kind of a curriculum that I like to go through with parents before they have their baby, ideally. And we kind of talk through a bunch of different things, from before baby arrives to what happens at baby's arrival, and then like the first and the second week. And so today I wanted to talk through specifically sleep, because sleep is a huge issue for parents. And there's a lot of uncertainty when it comes to sleep, and people tell you all sorts of heinous things about how bad it's going to be. And some of it's true, but it's often not super helpful to be like, oh, just sleep now because you'll never sleep again. Not the case. Now, the first thing to go through and talk about is that newborns actually sleep a lot. Probably 16 to 20 hours of their day, they are asleep. And the nice thing, this was just put in jest here, is that sleep when the baby sleeps and fold laundry when the baby fold laundry, is that they feed, they sleep. They feed, they sleep, they feed, they sleep, and that's what they do all day long. The hard part is, like, you have to live a life, and you have to take care of all the things that have to happen during the daytime and talk to all the people and do all the things still, and so that makes it a little bit of challenging. Now, what I always tell parents is that getting days and nights straight is really one of the first things that will really help you to get into a good sleep routine. Obviously, you're not going to sleep train your newborn baby, but you can teach them that during the day, we feed a lot, and at night, we feed less frequently, and we sleep more between those feedings. A couple things that you can do just right within the first few days to get this set up for success. Number one is bright room and lots of noise during the daytime. That helps them realize that during the daytime we're awake. And then conversely, at night, dark room, feed, back to sleep. Feed, back to sleep, feed, back to sleep. That gets them in the routine of during the day, I feed frequently, and it is loud and it is like bright in their house. And then at nighttime, the converse is true. It's dark, it's quiet, we feed, back to sleep, feed, back to sleep, feed, back to sleep. If you practice this and try and get more feeding episodes in during the day, even waking baby up during the daylight hours to feed them extra times, then they'll get into the habit of feeding more during the daytime and less at nighttime. Now, one thing that parents often are questioning or concerned about is when waking up at night. Do I have to wake my sleeping baby up at night? Because they always told me, don't wake a sleeping bear, don't wake a sleeping baby. Well, until they're back at birth weight, which usually takes about 2 weeks, we should be waking them up every 3 to 4 hours at night. Now, ideally during the day, they're waking up every 2 to 3 hours, getting a good feeding in, and then going back to sleep. But then at nighttime, I think, unless there's some extreme issue with jaundice or weight loss or something like that, that typically 3 to 4 hours is fine during the overnight shift. But I would set my alarm for 4 hours to make sure that baby doesn't keep sleeping, because it does have an impact, especially if you're nursing on your supply. If you're getting too much sleep, it can cause mastitis or other things like that, or limit supply if you don't do that. You can probably hear our washing machine right upstairs. Once baby is back to birth weight, then you don't have to set the alarm at night. Now, if you're getting up because you're worried about your supply, or you have to pump, or uncomfortable or something like that, just feed the baby. Wake them up and feed them, because that is usually the fastest way to get back to sleep. But once they're back at birth weight and your doctor's okay with it, then you can say, I'm going to let them sleep longer stretches at night and try and feed them even more during the day. Now, there's a couple things that you can do, especially in the first few days when things are really difficult when it comes to getting enough sleep, is if baby's had a feeding and they're fussing, what you can do is, if you have a partner, have your partner hold baby and stick their pinky finger into the baby's mouth and let them suckle on that, and they'll fall asleep while you go get some rest. That is perfectly fine and acceptable to do. Once latch is good and milk is removed, you can also introduce a pacifier. You don't have to wait some arbitrary number of days, weeks, or months to introduce a pacifier. What the American Academy of Pediatrics says, what the lactation people say, is that once you have shown that latch is good and that milk removal is happening, then it's fine to introduce the pacifier, which is usually in the first few days. We don't want the pacifier to be like, I don't want to feed the baby, I'm just going to give them the pacifier. But after a feeding, if you need to get a little bit of rest, you can have your partner put their finger in their mouth and let them suckle while you go hop into bed and get some rest, or give them a pacifier, get them swaddled, which is my next thing, swaddling. Swaddling helps a ton. The reason that swaddling helps, and that I like swaddling, and we are huge swaddling proponents in our house, is because babies do this every time that there's any sort of noise. Hey, Gloria, I'll be done in 1 minute. Babies do this when there's any sort of noise, and so they're always waking themselves up. The swaddling helps to decrease that reflex. There's a baby right there. There's that baby. We can swaddle her up in just a minute. 1 second. Can you stay out of the camera? Swaddling helps your baby to suppress those reflexes. It makes them feel warm and tight, just like they were in the womb, and it works exceptionally well, especially if we're looking for a longer stretch of sleep to get them swaddled up. It is safe. It doesn't hurt their hips. It doesn't cause any other big issues. Instagram and TikTok make everything seem like it's the worst thing in the world. Swaddling is perfectly fine. And then the last thing that I'll briefly touch on is safe sleep and SIDS prevention. And so parents often worry a lot about SIDS and do whatever they can, of course, to prevent SIDS. And really what we know, like you don't have to get the fancy monitors and alarms and snooze and owlettes and those sorts of things. Like if you need those to get good rest, get one. If you're that concerned, which some parents are, understandably, about it, but the vast majority of the time those don't help and they don't prevent SIDS. What we know helps with SIDS is making sure that baby sleeps flat, which means we're not going to elevate the crib. Even if your doctor is saying for some reason, there's still this like prevailing thing of elevate the head of the bed just a teeny bit, or if they have a stuffy nose or something like that, elevate the head. Keep them flat. And then you want a boring sleep surface. So boring means no pillows, no blankets, no stuffies. I know. Gloria's like, no stuffies. And then just a boring sleep surface. It's not the kind that's worthy of Instagram. It's just a boring sleep surface. You can put the pictures in it. You can put the pictures up of baby and everything like that. But then after that, you want to take all those things out so the baby sleeps flat on a tight sheet, boring, swaddled up, and then separate. Now, the acronym is ALONE, but I think parents are like, I don't want my baby to sleep in a different room. I don't want them to be alone. What I like to say instead of alone is just separate, a separate sleeping surface. They have these things that pretend this is your bed, and then they have like a little, it's almost like a sidecar where baby can sleep here and then parents can sleep here and be safe. That's a great way to do it. Or a bassinet next to your bed is a great way to do it. But there's a lot of risk when it comes to sleeping with baby. I like parents to be able to connect it and bond and all those sorts of things. But I have seen a lot of families that have been devastated by a parent rolling over, baby falling between the head of the mattress and the top of the bed, or baby falling off the bed, or a blanket or a pillow or all the other things. Now, the most dangerous time, the time that I've seen this with, that it's just awful and devastating in so many different ways, but the most common time is couches and chairs. If you are tired, do not rest in a couch and a chair with your baby, because it's a high likelihood that you're going to fall asleep and then that baby can fall in between you and the couch, or you and the arm of the chair, or in a pillow or something along those lines. If you keep your baby on a flat, boring, and separate sleep surface, you've done everything that you need to do to prevent SIDS. Hopefully that's helpful. Hopefully that makes sense. I have all these different areas that I talk about. For those that are in Lincoln or are looking for a pediatrician, we offer a cool thing at our practice. We do direct primary care, which means you have a small team that works with you. We have lactation. We have Lindsay and Clara who both do lactation. We come to your home for those first visits in the first week of life so that we can help you where you are rather than making you come into the office and those sorts of things. And then everyone's favorite feature is text messaging, because parents have so many questions that they love just being able to text, like, hey, is this normal? Hey, is this normal? What about this rash? Can I send you a picture of my baby poop? We get loads of pictures of baby poop. So if that's of interest to you, check it out. I know. All sorts of baby poop pictures. Take care.